Um, Hello, I am Dr. Sripathi. I am a pediatric urologist, basically a surgical specialist who deals with genitourinary problems in children. I've been practicing for close to 25 years in Chennai and mainly in Apollo hospitals. In 2012, we started using the robotic platform, what's called the Divyansha robotic platform, to do minimally invasive surgery in children, especially in genitourinary disorders. I started this after obtaining training in the US in both Chicago and Stanford. And till date, we have done close to about 120 surgeries. We just wanted to talk to you about one particular surgery which was very challenging, and that is Divyansha, who's here. She's close to about 5 years of age, and I'm very thankful to Mr. and Mrs. Biswas for agreeing to this interview and testimonial. Now, Divyansha has got a block in the ureter somewhere in the lower third of the ureter. Now, the ureter is the tube that comes down from the kidney and goes and joins the bladder. Now, this block is something we don't know. It must have been something that she was born with. What happens because of this block is that the urine stays back in the ureter and does not flow freely down. When we initially reviewed her, we were a little doubtful about what to do. Open surgery would have meant a lot of dissection, taking a flap of the bladder up in order to meet the ureter, extensively dissecting the ureter, all of which would have meant a great amount of disturbance to the structures there, a very prolonged post-operative period, a lot of pain and discomfort for the child. So I just discussed the option of using the robotic platform to do this surgery, and both the parents readily agreed, and that is what we did. So at the time of robotic surgery, we found that the ureter was quite big, up to 2/3 of its length, and in the last 1/3 of its length it was quite narrow. But we could actively see the peristalsis, which is the to and fro movement of the ureter, something like the movement of a worm with which urine is pushed inside from the kidney into the bladder. We could see it going across the block into the lower third of the ureter. So we had about 2 or 3 people, including my good friend Dr. Deepak Raghavan from the urology department. I had called him to be there, and so we discussed on what would be the best option, and we thought the best way of dealing with this was to open the block at the point where there was a block, and there we found a flap valve, something called a urethral valve, which is quite rare. We cut the valve and then we rejoined the ureter. Now, all this was done using the robotic platform, which means we were able to see whatever we were doing at 10 times magnification, use the tiniest of sutures so that we didn't change the alignment of the ureter. In fact, we excised the area of the block, made the ureter big above and below, and then rejoined it in the most optimal way with a stent inside. This is an unusual problem, and I think the robo is tailor-made for this type of problem. And you can see basically she's a child who gets very easily upset, but I think we were able to do this with a very minimal amount of pain and discomfort to her. I don't know whether she's still angry with me, but be that as it may, she's quite comfortable now. It's only a few days after surgery and she's quite happy, and they're actually ready to go back. So the robo has proved its effectiveness in genitourinary surgery in children, and the application of the robo is myriad. It can be used for surgeries on the kidney, it can be used for surgeries on the tube leading from the kidney, which is the ureter, it can be used for surgeries on the urinary bladder, it can be used for surgeries on the pelvis, and so on and so forth. So this, I thought Divyansha was an excellent example to discuss on how the robo was very useful to get rid of a block in the ureter. Thank you.
Hi, myself Devnath Biswas. I had come here for my daughter Divyansha, who is 4 years 10 months. I'm very thankful to Dr. Sripathi and his team and Apollo Children's Hospital for taking care of my child's surgery in a very quick period of time. She had a minimal surgery with minimal pain, and we are very pleased to let everybody know that She had a very good experience in the Apollo Children's Hospital and specifically Dr. Sripathi and his team. Thank you.